Today, I have the great pleasure to talk to one of the top international professionals working in the field of nutrition and human behavior. A very interesting field, not only limited to omega-3, but also to many, many other nutrients. We will talk to Dr. Alex Richardson. She is working at the Department of Physiology, Anatomy and Genetics at the University of Oxford in the UK. She has published numerous papers in some of the best scientific journals and has held many, and I mean many, presentations in international scientific events. Last but not least, Dr. Richardson is also founder of the Food and Behavior Research Foundation. Welcome, Alex, and thanks very much for your time and sharing some of your experience with us.
Oh, thank you, Peter. I'm very willing to do what I can to help inform and educate people who want to know more in this area.
Wonderful, Alex. Now, you're one of the international leading scientists in the field of omega-3, ADHD, mood disorders, autism, dyslexia, and many more, and especially among our children, or found more and more among our children. You pointed out in numerous studies that the importance of nutrition or in order to manage better these conditions. One important part of nutrition is obviously the relationship or the balance of omega-6 to omega-3 fatty acids in our diet. Now, tell us a little bit how you first discovered this relationship and the importance of this relationship for these disorders.
Okay. Well, as it happened, I'd been already for about 6 years throughout my own PhD and postdoctoral studies working with ADHD, dyslexia, other conditions, including schizophrenia, may I say, as well as others. But the focus of my early work was neuroscience and vision in particular.
Okay.
And the role of visual perception, attentional aspects that can cause difficulties for many children with conditions like dyslexia, reading difficulties, attentional problems too, because 1/3 of the brain is devoted to vision, quite frankly, in terms of it being the dominant sense. My link into this field was realizing that long-chain omega-3 and DHA in particular, one of the special fats found pretty much only in fish and seafood, you need these omega-3, critically you need them for vision, to build a visual system. And in order, to be honest, for all neural processing, the moment I came across this link, it was obvious to me that this was worth looking at to see if we could improve the visual and attentional problems of the children and adults that we were working with. And so I set about setting up randomized controlled trials. And that's why it was the right time, because my first study was in fact the first randomized controlled trial to try to answer the question, might something as simple as a dietary supplement, mainly fish oils, help children with attentional problems, ADHD symptoms?
And what were your outcomes? Did you really see improvements?
We did. It was a pilot study to begin with. That's what you do. I chose my population quite carefully. The children were actually dyslexic, but they also had ADHD type symptoms that took them outside the normal range. The previous studies in this area had all been to do with ADHD. I was the first person to do a study of dyslexia, but as it happened, the ADHD symptom outcome that I chose, my study was published just before that of the main group in the USA who had already shown low blood levels of omega-3 fats in children with ADHD type difficulties. Theirs was the next, study to show benefits from supplementation in children with behavior and learning difficulties.
And now the brain is really developed during the last part of pregnancy, last 3 months, and I think the first maybe 1 or 2 years of life or during the breastfeeding period. Does it still help to give children DHA afterwards? So let's say if they're in the age of, I don't know, 4, 5, 6, 7 years or even older?
That is such a good question, Peter, because I know you've already been speaking with Professor Michael Crawford, who is really probably the most eminent scientist in the world in the study of omega-3. First showed in the early 70s that the brain and nervous system of any species that has one utterly relies on DHA, this long-chain omega-3. Nutrition of the mother, as he emphasizes, and during early life. We have very good data now, it is absolutely definitive, that for things like preventing prematurity, supplementation with long-chain omega-3 helps. And for almost every aspect of brain development in that critical first 1,000 days. So I will say the optimal time for anyone to get omega-3 into anybody is in that early period. But it's so important for us to answer the question, is it ever too late? That's what my studies, which no, it is never too late. It's always best if you can, and there may be with very serious nutrient deficiencies. We know this with other nutrients like iron, which many pregnant women are lacking. That can lead to long-term and in some cases irreversible changes to the brain and nervous system and behavior. Again, that one's implicated in behavior problems like ADHD. But with regard to omega-3, yes, you want them before conception, quite honestly. The fastest period of brain growth, as you say, before birth, is in the last trimester.
Right.
Most studies of pregnancy, therefore, and for practical reasons, have involved supplementation only in the later stages of pregnancy. But there's also a big literature with regard to supplementation of infants and the addition of long-chain omega-3 to infant formula. In fact, that drove a lot of the research into long-chain omega-3 and long-chain omega-6 was the realization that most infant formula never used to contain the long-chain omega-3.
Okay.
And again, I think many people to this day just think omega-3. They are not aware of the critical difference between the long-chain polyunsaturated fats, because that's what omega-3 and omega-6 are, but the fact that it's the long chain that matter biologically. They are the ones that matter for your heart, your immune system, your brain, for hormone balance, for immune regulation, etc. The long chain matter. And so the dietary sources, walnuts and flax oil and plant-based omega-3 do not do the same thing. The only exception there is some algae, because this is where the fish get their omega-3 from. But yeah, we need the long-chain omega-3, and with DHA, it must be ready-made. Yeah. With EPA, the other long-chain fat, it's better if that's ready-made, because we now know humans are not good at converting shorter-chain omega-3 and 6 into the longer-chain ones that really are critical.
Yes, no, I fully agree. Now, have you seen in your work a direct relationship between, let's say, a DHA and omega-3 deficiency and ADHD and autism? So,
absolutely, in the literature, very, very clear indeed that if you measure the blood levels of long-chain omega-3, meta-analyses show without a doubt that individuals with ADHD, mainly children, have been studied, but it also shows in adults, because this condition also affects adults, that yes, blood levels of EPA and DHA are low compared with matched controls. We also, there's enough studies have been able to look at diet as well. It also is clear that you cannot explain all of this reduction in blood levels of EPA and DHA by diet. It contributes, sure, and eating lots of fish and seafood and a healthy Mediterranean type diet will certainly improve matters. So the research that I and others in this field have known about really for 20 years or more, the suggestion is, and we have some evidence to back this, that the very predisposition to ADHD, dyslexia, dyspraxia, autism, depression, schizophrenia, bipolar, may involve differences that mean dietary requirements are higher for these groups than they are for the general population.
Okay, so excuse me, I'm drifting off a little bit from our but as you were talking, I was and thinking about Professor Crawford. There is a fact that the amount of available DHA is limited. But on the other hand, we have a ever so much growing population in the world.
Okay, we have a problem, Houston.
We have a problem. Also, we have a problem. I see that, if I just look at over here in Germany or also in Spain, it doesn't really matter. Fish is more and more expensive. It's an expensive food. Quality supplements are also expensive. Are we heading into a problem that we're having, a social-economic problem, actually, where you have a large portion of population which maybe will have not so much access to DHA, and a small portion which really can afford that? Have you ever seen anything like that? I mean, in your experience?
We could do a whole interview and documentary on this. I shall try to be brief, but I agree with you completely. The population growth that has continued to go on and on, I think really we are up against some really serious limits if we don't start treating our environment better. Let's start though with aquaculture, because we could do so much more if we look after our fish stocks, firstly out in the wild. We need to make sure that we don't destroy the environment that is needed, which includes the seabed, for the wild fish populations to be, healthy and sustainable. Fish farming, aquaculture, and all kinds of other seafood. This too, and Michael is a pioneer in this area. We could, and here in the UK, we should start yesterday restoring our coastline, preventing toxic pollution. And it really is the case that we could produce an awful lot more of the long-chain omega-3 that way. But when it comes to the big gap, and it is a big gap now between the total world population, I'm going to say two things. One is the balance between omega-3 and omega-6, okay? Vegetable oils, very rich in short-chain omega-6 fats. These have been the staple of the ultra-processed food industry, and we were all told that butter and meat fat, would give us heart disease, for which I'm afraid there's no evidence, quite a lot of the opposite. So these vegetable oils, it had reached the point where they were between 8 and 10% of calories in the US diet. It depends on the individual. This is not healthy. And because there is competition between the omega-3 and omega-6. They do different but complementary things in the body and brain because of substances we make from them. I think for anyone to grasp, to understand why omega-3-6 balance matters, they need to understand that for inflammation, speaking very broadly, the omega-6 fats and derivatives made from them promote inflammation, whereas the long-chain omega-3 give rise to substances that are anti-inflammatory, very powerful anti-inflammatories, and a whole series of different kinds. Right. So for inflammation, which we know underlies most chronic, systemic, non-communicable diseases, okay? Blood flow. Again, The derivatives from omega-6 are pro-thrombotic, are likely to promote our risk of heart disease, stroke, cardiovascular complications, including vascular dementia, of course. The omega-3, substances made from the long-chain omega-3 do the exact opposite. They relax blood vessels, they improve blood flow, and they also reduce blood coagulation. So we are talking balance. And because of this, as you say, world shortage relative to people of fish and seafood, where you can get long-chain omega-3 ready-made, one thing we must do is tell people that cutting down their omega-6 intake, reducing their intake of vegetable oils, which really means avoid processed foods.
Yes.
Okay? That alone, with no other changes, will double tissue levels of EPA and DHA. So I always tell this, it's another one I tell to every vegetarian who keeps trying to tell me that walnuts and flax oil, no. Because again, people do not understand the basics. The short chain omega-3, not really that important, except for being turned into, we have a pathway in the body that will convert, if it works, short chain omega-3 to long. But it has been definitively shown, more than 10 years ago, the consensus was in. Human beings do not reliably produce enough long-chain omega-3 from short-chain to meet the needs of a healthy body and brain. So cut the short-chain omega-6. The other solution, Peter, because I always want to focus on solutions, is algae. Fish and seafood, and they have many other nutrients that are, again, vital for body and brain. So the best source, eat your fish and seafood if you can afford it, if it is available. But yeah, the algal sources now, which, again, they're expensive at the moment. These need to be scaled up. There are two main ways of making the very special algae that are rich in EPA and DHA. One of them is photosynthesis, sunlight. So in places like Arizona, Australia, fine, you can have factories whereby sunlight, these algae, turn it into EPA and DHA. The same could be done in large parts of Africa, the Middle East, if people would make the investment. The other method that different algae use, I love this one. It's the fermentation method.
Okay.
And I'm waiting for one of our big randomized controlled trials, in healthy school children in the UK, where we found benefits. We were using for that an algal source DHA. Now, this was from a fermentation method of making it. Mm-hmm. What is the raw material for fermenting that these algae need? Mm. And the answer, sugar.
Right.
Yes. We have the answer. Take the sugar out of the human food supply, because sugar in excess is completely toxic. It is also addictive. Yeah. And give it to the algae. They will make abundant amounts. And again, because for the fermentation, you can actually build the production plants almost like high-rise tower block flats. You can almost put one vat on top of another, feed them the sugar. That is, to my mind, unless we do a better job of restoring our own coasts, and marine production, and cleaning up our oceans and coastlines to do more and better aquaculture, then I think there's no escape from the need.
Yeah, no, you're absolutely right. Especially also with the comment you made on the omega-6 and omega-3 balance.
Oh, yes.
I spent many years also living in Spain, with all the Mediterranean diet, which is really wonderful. Mm-hmm. But you have a lot of people, which have, I would say, at least once a week, wonderful sardines, which are very rich in omega-3.
Brilliant.
They taste very well, but if you fry them in sunflower oil, they swim in sunflower oil.
Yep.
You're neutralizing a lot of your benefits, which come from the omega-3 from the sardine again.
That's exactly exactly what the studies show, Peter, as I'm sure you know, but many people don't. It is only when fish and seafood are deep fried or even shallow fried in buckets of omega-6 rich vegetable oil that you don't see the benefits in the population studies for the heart, for the immune system, for the brain of fish and seafood. So you're quite right. Oh dear. And again, people need to know these fatty acids are highly perishable. This is why the quality of supplements matters. This is why too much light, heat, or air will very quickly destroy these highly reactive, fatty acids. Omega-3 are even more perishable than long-chain omega-6. But the polyunsaturates, that's right, they can very easily be degraded. What we therefore need to do is to teach people that you don't need to overcook fish. Of course you don't. Yes. In fact, it's far better if it's very lightly poached, steamed. And of course, the Japanese with their sushi I'm not a great fan of raw fish, I will say that. Or it needs to be very well marinated. And well, high temperatures will destroy. Yes. Mixing with omega-6 rich vegetable oils is close to criminal in my mind.
Exactly. Well, you see, this is exactly one of the reasons why we're doing these interviews, in order to chat about these things and cover the message, Now, allow me to go back once more to ADHD.
Of course.
Because I think this is really important, because I've met a lot of parents which have children. First of all, first thing I'd like to say, and I'm not sure what you think about this, but I think the diagnosis ADHD is given very fast at the moment. It's very quickly to children. and a strong medication, like, I don't know if the pronunciation is correct, Ritalin or Ritalin.
Ritalin, yeah.
I think in many cases it is not necessary. And we saw also with some of the parents which are taking our products in Spain, that they also see positive effects with just simple omega-3 supplementation. And I'm always saying, even if you don't even need to avoid Ritalin, but maybe if you can reduce the dose by an omega-3 supplementation, that's already a huge step forward. Do you think that is correct? Have you also made this observation?
Okay, I largely agree with almost everything you're saying here. Let's start with the diagnosis, because this is it. Across the whole of psychiatry, psychology, these diagnoses, they're descriptions. They can be very good and very refined descriptions, but they are only that. And the ADHD diagnosis, you're quite right. This has changed over the years. It was particularly broadened out in the early 1980s with the change in diagnostic system that was brought in then, and almost the creation of attention deficit hyperactivity disorder. There always had been, things that captured severe hyperactivity, restlessness, and so on. But the bringing of attention into this broadened it out then. Let me say that, of course, the cardinal diagnostic features: attentional problems, inattention, hyperactivity, and impulsivity. And the way psychiatrists are taught as well to look at this diagnosis is as two dimensions: inattention, which can exist in isolation and can give you the diagnosis alone; hyperactivity, impulsivity, or both. So you get the combined type AD. Now, firstly, what all the neuroscience says, there are actually three dimensions here. Hyperactivity is not identical to impulsivity. They may correlate tightly, but they are different things. And again, rather than just focusing on the symptoms, a good medical system and a good clinician will always be looking for underlying causes and trying to see if we might be able to treat those, rather than, as the drugs used, the stimulant medications like Ritalin, and most medications used across psychiatry, actually, they can help reduce symptoms But all the evidence shows they do nothing at all to tackle underlying causes.
Okay.
Another thing about the ADHD diagnosis is just how massively it overlaps with other diagnoses, both physical and mental. But let's focus on psychiatry. Now, again, for the last 20 years ago, big population studies in Scandinavia absolutely showed if a child met full criteria for ADHD, 2/3 of those children had another different full psychiatric diagnosis. No, sorry, it was 4/5 had one other diagnosis. 2/3 of them had at least two other diagnoses.
Okay.
I was getting clear. So if you are told that your child meets criteria for an ADHD diagnosis, quite frankly, that's not telling you very much at all until you know more about, okay, what are the other issues that, to my mind, really do mean that treating ADHD as a single entity is just wrong.
Okay.
It works very well if your main motive is to, give out a lot of medications that will kind of, suppress the symptoms. But it is not helpful at all for those parents or teachers or doctors, because I know many very good doctors and psychiatrists who will instead think, okay, is this, I will give two extreme examples, is this ADHD with anxiety, with some obsessional compulsive, type traits? This child is no behavior problem at all, but they have serious attentional problems, holding them back at school and in every way, but they have almost crippling levels of anxiety. That's their second diagnosis, which 4 out of 5 ADHD children do have.
Okay.
They be treated in exactly the same way as the ADHD child who has no anxiety at all whatsoever, who instead shows callous, unemotional traits, whose other diagnosis is conduct disorder and the beginnings of what you wouldn't diagnose till adulthood, which might be a personality disorder of the antisocial kind. Do you see where I'm coming from? Totally different in terms of the kind of nervous system that child has and the way in which it might respond to either diet or medication. I was onto this very early on because I've always worked really on the front line. My original background, Peter, after university, was teaching. That's where I came across the very large proportion of children who we are letting down, and our education system is not recognizing or dealing with the real issues. The dyslexia, the ADHD, the developmental coordination disorder, and now the autistic spectrum. That diagnosis has been rising exponentially. So you really have to ask, what is going on in our environment that is increasing the rates of all of these conditions? But I'll come back to ADHD. Here is the clinician. Parents have brought the child along. As I say, there is a huge difference here between the ADHD child with anxiety and, let me say, depression. Very, very high overlaps between ADHD and depression. If you take, as good clinicians do, if they have the time, a full case history, you ask about family history, you will probably find that one or both of the parents may themselves have depression, or perhaps some addictive disorder. Perhaps, one of them, it's a predilection for alcohol, who knows, or smoking. So you will get more of a picture there. What is it that might help this child? And I will say as well, the stimulant medications, it's not well advertised. They are far more likely to be less effective and have more side effects in those ADHD individuals who have the anxious and internalizing and depressive other symptoms than ADHD. Mm-hmm. That really interested me from the very beginning because I was working across different conditions, researching both ADHD and doing some of the earliest studies. We published the very first case studies of both depression and schizophrenia. Okay. Mm-hmm. On almost proof of concept. Sometimes you can indeed, at the single case level, dramatically improve things if you get the nutrition right. But yeah, the link between ADHD and mood disorders. We do now know, and we have meta-analyses of the very large number now of randomized controlled trials. Long-chain omega-3 are effective for reducing symptoms of depression. There have been fewer studies of bipolar disorder, but here in Oxford, we did the Cochrane review there and showed that of the bubbling under studies, helping, again, alleviate the depression rather than to treat the mania. So yeah, I think we always need, when dealing at the clinical level, to look at the person and not just think, oh, the label is ADHD and the answer is stimulant medication.
Would you say you had more success with EPA-rich oil or DHA-rich oils, or doesn't it really matter?
Now, here, let me start by saying there is no natural food that provides one without the other. Yes, but this question has absolutely been one that researchers, have been onto. So have companies, of course, to try to decide which one should they put in their supplements or perhaps try to patent. Now, from the earliest, it was a bit of a surprise, but EPA rather than DHA appears to be, if you have to choose one, that is the one that is most effective against depression and other mood disorders. Okay, so for depression, I would say the data are pretty clear. And it's between 1 and 2 grams a day of EPA that characterizes the most successful supplements. That is now in published treatment guidelines that any interested doctor can download. It's an open access paper from the world's leading psychiatrists and researchers in this area. So if we come back to the ADHD individual, if they have a profile that is very mood swings or anxiety, or if mood and emotional problems are part of what is causing their behavior problems, okay, I would then tend to suggest that an EPA-rich supplement might be better. But in other cases, you've always got to look at the individual. If there are visual problems, it's DHA, not EPA, that is needed. 1/2 of the retina needs to be DHA. If it isn't, vision does not work properly, okay?
Right.
And again, handwriting, because another condition that overlaps hugely with ADHD, with the autistic spectrum, with dyslexia, is dyspraxia, or developmental coordination disorder. So handwriting difficulties. We've seen at the individual level in children in some of our trials, absolute transformations within 3 or 4 months in that child's ability to hold a pen or pencil, to be able to form letters, to even be able to place them in the right place on the page. So yes, if visual, perceptual, or visual attentional issues are part of the profile, I would not want to not give quite a lot of DHA.
Yes, yes.
Again, we have to remember, it's really become clear in recent years, if you want to raise blood and tissue levels of any particular omega-3 or omega-6, you've got to give that individual fatty acid. We do have some ability to turn EPA into DHA. We don't seem to do the reverse. Very clever, sophisticated studies have been looking at this for a long time. Can we retro-convert? No, it seems we can't. But if you give DHA, the interesting thing is EPA builds up because you are sparing some of the EPA that would otherwise have to be used to make DHA, to keep your vision and your brain and your heart going. So I do think it's a slightly artificial question. Is it EPA or DHA? But having said that, no question that for depression, EPA or EPA-rich supplements appear to be performing best. Also, interestingly, in the area of heart disease,